Dear students, after the 3rd month or the 12 weeks, the human embryo is referred to as fetus. It is now known as fetus. Before that, it was called as embryo. Up till 12th week, the organ formation is completed. All the organs are formed by the 12th week of pregnancy, and the remainder time or rest of the time is taken up by growth. Means the whole organism's formation is completed up till 12th week of pregnancy or the 3rd month, and then after that the rest of the time or rest of the 6 months are taken up to grow or to increase the size of the body, to reach the optimal size that is suitable for a baby. Now we will see what are the hormones that control the process of birth. Is that the mother or the fetus that controls the timing of the birth? According to an old hypothesis and theories, it is the mother's hormonal system that affects the timing of the birth. For example, the low progesterone level. But what causes the progesterone level to fall down? So the recent evidences on the female reproductive system and the process of birth, they suggest that there is very much involvement of the fetus in this process as well. The fetal pituitary gland, when the birth time comes, the fetal pituitary gland starts secreting a hormone known as ACTH, adrenocorticotropic hormones. The adrenocorticotropic hormones, they will stimulate the adrenal glands that are present on the kidneys. The adrenal glands, they start producing corticosteroids. The corticosteroids, they cross the placental barrier, they enter the blood of the mother, and then they decrease the level of progesterone. As soon as the level of progesterone starts decreasing, there is an increased secretion of oxytocin by the pituitary gland at the same time. That will induce the labor pain or the contraction of the muscles of the uterus to expel the baby outside the body. This is known as the labor pain, and this time is now known as the labor. This will provide the force to expel the fetus. The cervix, as you have seen in the diagram of the female reproductive system, it dilates or opens up to help in the removal of the baby from the body. The uterus contracts, and the contraction movements, they move from top to bottom to help in removal of the baby from the mother. They push the baby downward, and that will lead to the delivery of the baby. After that, the umbilical cord that connects the baby with the mother, that will be ligated or it will be cut, and the baby is released from the mother.